We can start our introduction as good morning. My name is Jessica. One of the registered nurses. Working in this community health center. Please be seated. Can you please tell me your name and age for documentation purposes? Then the interlocutor may respond you saying good morning nurse. My name is Lucy and I am 50 years old. Then respond to saying okay Lucy, I understand that you have been scheduled to have an electrocardiogram. Am I right? Then the interlocutor may respond you saying, yes nurse. I have been experiencing chest pain and some other discomfort for the past few weeks. Before, my doctor advised me to do the test called ECG. However, I do not have any idea about that. So, can you please elaborate to me a little about the procedure? Then respond by saying, I am glad to explain to you that. Before moving further, may I ask you some questions regarding your condition? Then the interlocutor may agree with that. Then continue. Do you have any symptoms like chest pain or anxiety at the moment? Then she may respond. Yes, nurse. I have been experiencing these symptoms for quite a long. That is why my doctor advised me to undergo this test. Then ask. Have you ever done the electrocardiogram before? Then the interlocutor may respond. You saying? No nurse. I have never done it. This is the very first time. I am going to undergo this so I am a bit nervous. Then respond to saying. Your nervousness is quite normal. Do not worry. I can provide you with the complete information regarding the electrocardiogram. So once you come to know about it, you will be more relaxed. I will explain what an electrocardiogram is, its function and the procedures. So you can ask me any questions at the end of it. Is that okay? Then the interlocutor may agree with that. Then continue first of all, an electrocardiogram is a test that measures the electrical activity of the heart. It is one of the simplest and fastest tests used to evaluate the heart. Electrodes are placed at certain spots on the chest, arms and legs. The electrodes are connected to an ECG machine by lead wires. The electrical activity of the heart is then measured, interpreted and printed out. Am I clear to you? Then the interlocutor will agree with that. Then the interlocutor may ask you that's great nurse. Is there anything that should be done before the test? Then, respond to saying, yes, of course. I can explain the pre-electrocardiogram requirements on the test day. You will be asked to remove any jewelry or other objects like mobile phones that interfere with the test. If your arms or legs are very hairy, the technician may shave small patches of hair as needed, so that the electrodes will stick closely to the skin. Then you will be asked to remove clothing from the waist up. You need to lie flat on a table or bed for the test. Then the electrodes will be attached to your chest, arms and legs. Then the lead wires will be attached to the electrodes. Then the ECG will be started. It will take only a short time for the tracing to be completed. They record the electrical signals. Once you've completed, the technician will disconnect the leads and remove the electrodes. Then the interlocutor may ask you will there be any sort of pain? Then respond her do not worry, it is a safe and painless test. You can resume your normal activities after your electrocardiogram. Are you clear? Do you have any questions for me? Then, the interlocutor may ask you after the test, will you be able to discuss the results with me? Then, respond to saying, I understand your anxiety. However, your doctor will discuss the results with you on the same day of your electrocardiogram or at the next appointment. If your electrocardiogram is normal, you may not need any other tests. If the results show an abnormality with your heart, you may need further management. It will depend on the results and your doctor's decision. Okay Lucy. Do you have any more questions for me? Then the interlocutor may respond you saying, no nurse. I am very much clearer now. Thank you very much. Then tell her like, okay, apart from that, it is mandatory to provide your consent in accordance with the hospital policy. Thank you, Ms. Lucy. If you have any other concern, please call me at any time. I will be happy to help you. Please be seated. I will be back with all arrangements.